There are a number of websites on the internet that regularly publish data sets for public consumption. The owners of these websites might be government agencies, nonprofits, or private companies or individuals. On these websites, you can generally download the data sets, you can analyze them, or they might even provide a way to view or visualize the data using various bar graphs and pie charts and things like that. One such website is the CDC, so the Center for Disease Control publishes things like COVID data on their website. This particular data set breaks down the deaths by age and sex. If you look down a little further, it also does by the state, by the year, and the month. This particular data set has 16 columns in it and nearly 100,000 rows. Look down a little further, it will show you the columns in the data set, what the description is, and what the data type. You see all 16 columns here. Some of them are numbers, some are plain text, others are date and time fields. So this site will let you just come and export and download the raw CSV file with all the data in it, or you can come in and create your own visualization. Now, each website is different in how it will let you visualize the data. Whoever programmed the website decided what views you're going to be able to see, how you're going to be able to slice and dice the data. So you may or may not be able to get the data set down to a subset that really is beneficial for you. There are other websites on the internet. This one happens to be Statista.com, that will go out and pull those public data sets from various sources and provide more uniform way of visualizing that data. They generally give you a basic view for free, and if you want to slice and dice the data in a very specific way, you generally have to subscribe to their service. But again, you're limited in what the programmer wanted through the web interface to allow you to do. So if you have a data set that you want to analyze, it might be one of these public ones, or it might be your own private one or a company one, and you want to analyze in a very specific way, we've created a tool here that will let you do that. Our platform is called Digets, D-I-D-G-E-T-S. This program is publicly available for a free download on our website, digets.com. This is our browser. On the Databases tab on this browser, it lets us create relational tables and then analyze them very quickly and easily. So I go grab that file, that CSV file I downloaded from the CDC website, grab it with my mouse, and I drag it over. We have a window here in which you have definitions. I have a couple definitions, but they don't conform to the COVID data. So I'm going to drop this file in an open area of the window. It'll grab the first, so we can peek at the file here, and you see it's got a header with all the column names at the top, and then it'll show you the first 4 or 5 rows of data. But I want to create a definition based off that first row. I'm going to make this a little shorter, just call it COVID. So now I have a definition of 16 columns. Because it's CSV, it doesn't give you the data types, so it'll create a definition here with all the column names, but it defaults to a string for each type. So we want to change some of these, as the year, the month, and all the death columns to be integers. Change the type to integer. That way we can do formulas based on the values within them. There's some date and times, but we'll leave those as strings for now. So now we're ready to import the data. Click the OK. It takes just a couple seconds to read in those 100,000 rows, and now we have a table with 16 columns and nearly 100,000 rows. If I want to see all the data, I just double click on the table here. It'll do a select all of all the data. Now let's say we wanted to analyze the data based on some very specific criteria. Let's say we wanted to only see the deaths of, say, 50 to 75-year-olds in the state of Wisconsin during the springtime. So see, you just come find there's a row here for sex. You can have all sexes, the male or female. We want to see just the males. Okay, now we want to see just Wisconsin. Now if I come up to a column header like state, for example, and I right click and I say show me all the unique values, this will give me how many different states. That's 54, but it throws in Puerto Rico, New York City, Washington, D.C., and then the United States as a total in here, so you get more than 50 states. We want to see just the Wisconsin ones. So here are all the males in Wisconsin values. Now we want to do it by a certain time of year, in this case the spring, so we want to just see the things by months. And then we only want to see springtime months, so we're going to show the values. I want just March, April, and May, and display those. So now we've drilled down. Now out of the 96,000 rows, we're down to 153, and these have just ones where the sex was male, the state was Wisconsin. We've grouped by month, and for those 3 months. Now I still have all the different age groups. So if I clicked on formula here for all the values, you'll see 1,800 deaths across all age groups. But we want to see just specific age groups. So we want to show the column values. And we said we want to do 50 through 75. So here's, let's select the 50 through 64 and the 64 through 74 years. 65 through 74. Click those. So this is going to give us now the total deaths for each age group in that area. So let's do a formula on that one. We'll see that we've had 352 deaths in that 50 to 75 year age group in Wisconsin during the springtime when the sex is male. So this lets us slice and dice the data to get very specific. We can do the same thing with the pneumonia deaths, the influenza deaths, for different sexes, for different age groups, for different states, by year, by month, by totals. We can slice and dice the data any way we want. We don't have to rely on what the web interface limited our choices to. So we created this data analysis tool to be able to come in here and slice and dice the data very quickly and show you some visualizations. Let's come up here and create a pivot table by state. So we want to pivot all the 54 different values there by the year. And we're going to sum the values in the COVID deaths. So this will quickly give us a pivot table of all the data by state, give you the total amount for each year. So if we want to analyze, and I can show you a chart, for example, maybe we want to see just a chart of the first 10 or so states. I can view that as a chart. There's your nice little bar graph. We can show you as a pie chart, line graphs, other ways of visualizing the data, just like some of these other websites will do, but we let you drill down and find very specific subsets very, very fast. We can do this even on big tables with, here's a table with 25 million rows, another one with 50 million rows. If we double click on this one, this is some customer data with 25 million rows, and we want to see all the different values by city, and show you a nice little chart. Pie chart. So this will tell you of the top 5 or 6, 7 different cities in this 25 million row column of customers. You can drill down very fast and see things. So I want to see just the people in Oklahoma, and in Grafton, Oklahoma. There's probably not a Grafton in Oklahoma. This is random data. But here's all the data, 495 rows in that 25 million row table. You can do this with all kinds of data sets, but you drill down very quickly, get the subset you're looking for, and let you visualize it in a pivot table or using charting. You can load in your own data sets, try this out, and let us know we're in beta, www.digits.com. Thank you very much.